Hi, my name is Kathia Skinner. I am a family nurse practitioner and doctorate student at Frontier Nursing University, and today I'm going to discuss my teaching project with you. Let's begin. The title of my teaching project is the MDS Infusion Nurse Educational Session. So what is myelodysplastic syndrome? Once thought to be a rare disorder, now myelodysplastic syndrome is the most common class of acquired bone marrow failure syndromes in adults. MDS is a collection of diverse clonal disorders of the hematopoietic stem or progenitor cells characterized by ineffective hemopoiesis, dysplastic cell morphology, and potential for clonal evolution. These patients can be critically ill with low platelets, white blood cells, or red blood cell counts, increasing the risk of bleeding, life-threatening infections, and/or severe anemia. Progression to acute myeloid leukemia is the most common cause of MDS-related deaths, followed by infections and risk of or bleeding. Only potential cure therapy for MDS is allogeneic hematopoietic stem cell transplant. The median age of patients diagnosed with MDS is 71 years of age, and the mean age of transplant, the cutoff for transplant for MDS patients is 75 years of age. Yet the mortality and morbidity rates for transplant is very high due to the rates or risk of infection and mortality. And yet the potential for cure or long-term cure is 30%. Therefore, the vast majority of patients that have MDS do not opt for transplant. In fact, higher risk MDS is treated with hypomethylating agents such as decitabine and azacitidine, also known as Vidaza. Another common medication is immunomodulatory agent known as lenalidomide. So why is it important to understand azacitidine? In May of 2004, azacitidine became the first FDA-approved therapy for MDS. It is the most frequently administered hypomethylating agent given to MDS patients in the Mount Sinai Hospital Clinic. For patients with low or intermediate risk MDS, the goal of therapy is to improve hematopoiesis and maintain or improve their quality of life. The oncology infusion nurse is critical in coordinating visits, providing patient and family education about their treatments, and reinforcing key concepts for safety, as they sometimes may be the last check. So, for a needs assessment, I conducted a Likert scale infusion nurse survey for the 7 MDS nurses, and the responses were scored as such: strongly agree, received a -2, disagree, -1, neutral, 0, agree, 1, and strongly agree, 2. So the statement, I am knowledgeable about the side effects and the risks of chemotherapy we administer to patients with MDS, the average score was 0.7. So the statement, I feel comfortable giving patient education regarding MDS and leukemia, the average score was 0.42. So who are the learners? 100% are female that are BSN prepared nurses. The race varies, however, the vast majority, 60%, are of Asian descent, 20% African American, 10 Caucasian, and 10 Hispanic. For age, 20 to 30 years of age has about 30% of the nurses. 20% is of 30 to 40 years of age. 20% is of 40 to 50 years of age, and greater than 50 has 30% of the nurses. And for years of experience, the vast majority of the nurses are relatively experienced, with 40% having 5 to 10 years of experience and 30% greater than 10 years of experience. The goal of this teaching project is to improve the management of patients with myelodysplastic syndrome by utilizing safe treatment practices and providing pertinent patient education. By the end of the learning session, 80% of the infusion nurses at Mount Sinai Hospital will be able to return demonstrate the appropriate technique for administering Vidasa for one patient during simulation, correctly answer 3 questions from a simulated patient related to the side effects of Vidasa, and identify 3 medical emergency situations during simulation. So I chose simulation as a method of instruction. During face-to-face simulation, learners have the opportunity to directly interact with other learners and the instructors in an environment that closely mimics a realistic scenario. This fidelity provides a safe, fun, and yet challenging space for learning and feedback. So let's move on to the review of literature. For study 1, titled The Effectiveness of Simulation on Recognizing and Managing Clinical Deterioration, Meta-Analysis, this study type is a level 1 because it is a meta-analysis. And a literature search produced 22 reports and 19 studies meeting criteria for inclusion, focusing on experimental studies testing the effectiveness of simulation-based interventions in recognizing and/or managing clinical deterioration. The findings of this meta-analysis suggest that simulations have a positive effect on nurses' ability to identify and manage clinical deterioration. Study 2, titled Systematic Review of Assessments that Evaluate Clinical Decision-Making, Clinical Reasoning, and Critical Thinking Changes After Simulation Participation. This study type is also a level 1, because it is a systematic review. It used various different databases that search for articles published in English from the dates of January 2000 to March 2017. 31 articles met the inclusion criteria and were assessed using the Mixed Methods Appraisal Tool for the Mixed Methods Study, the McMaster University Critical Review Form, and the Evaluation Guidelines for Rating and the Quality of an Intervention Study. The systematic review concluded that there was sufficient moderate to strong evidence that simulation has a positive effect on the development of clinical decision-making, clinical reasoning, and critical thinking in healthcare professions students. For study 3, titled Randomized Controlled Trial of Simulation versus Standard Treatment for Teaching Medical Students High-Quality Cardiopulmonary Resuscitation, this study is a level 2 as it is a randomized controlled trial. And it was an 8-month-long prospective randomized study of 70 fourth-year medical students comparing the effectiveness of high-fidelity simulation training to standard mannequin training for teaching medical students the American Heart Association guidelines for high-quality CPR. Outcomes were performed on a simulated cardiac arrest case adapted from the AHA Advanced Care Life Support SimMan Scenario Manual, and the data was analyzed using the Kushkal-Wallis rank sum test. Of the 74 eligible fourth-year medical students, data on 70 were available to analyze due to the absence of 4 participants from their assigned simulation session. High-fidelity simulation training yielded better results to low-fidelity CPR mannequin training for teaching fourth-year medical students how to implement high-quality CPR for chest compression depth and compression fraction. Study 2, titled The Impact of a New Pedagogical Intervention on Nursing Students' Knowledge Acquisition in Simulation-Based Learning, a Quasi-Experimental Study. This is a level 2 study as it is a quasi-experiment. And this study used a 2-group quasi-experimental design comparing students' knowledge acquisition between a control and interventional group. The control group experienced simulation scenarios based on a current model, and the interventional group experienced a simulation scenario based on a new pedagogical design 1 year later. The participants are students in the second year of their bachelor's degree nursing program. In December of 2013, 68 students agreed to be in the control group, and 60 agreed to participate in the post-test. In 2014, 69 patients agreed to participate in the interventional group, and 53 agreed to participate in the post-test. There was a significant improvement of scores in the interventional group in comparison to the control group. And so for a synopsis of the literature review, as for the differences, there was one meta-analysis article, one systematic review, one RCT, and one quasi-experiment. As for populations, one of the articles were nursing students and one was medical students, and the journals varied. As for similarities, the research suggests that simulation is learning-oriented, is an effective teaching method, addresses the knowledge-practice gap, improves students' performance and knowledge, and improves their overall decision-making. And here for the rationale. Simulations is an effective teaching method because it is learner-oriented and addresses the nurse's knowledge and practice gap through this cycle of observation and reflection, formation of abstract concepts and generalizations, testing implications of concepts in new situations, and then the creation of concrete experiences. And this cycle continues. So my personal philosophy of education is that education should be built upon the learner's current foundation of knowledge and experiences. This should be done while fostering and acknowledging their creativity, diversity, and individuality. All of these things are responsible for shaping the manner in which a student perceives and retains new knowledge. My selected theory is constructivism. The learner is the constructor of their knowledge through their personal experiences and consideration of those experiences. And so key concepts involve knowledge will be shared amongst the educators and learners. The instructor functions as a facilitator or guide. Learners will be gathered into small groups of heterogeneous students. Learners control their education process through their reflection on their experiences. And learning is a process where individuals construct and organize their cognitive constructions. So as for the appropriateness for the audience, well, as I mentioned earlier, the studies validated the effectiveness of simulations, increasing the students' knowledge, particularly in nurses and medical students, and helped bridge their knowledge gaps. So for objective 1, which is return demonstrate the appropriate technique for administering Vidasa for one patient during simulation, the learners will receive drug information on azacitidine administration, and they will observe its administration in a video demonstration prepared by the clinical MDS nurse. As for the time allotment, this maintains the same throughout the different objectives. So overall, the entire presentation will be 90 minutes. 15 minutes will be for the presentation, allowing for 5 minutes for each objective. 30 minutes would be for simulation, when the simulation will be broken into 2 different groups, lasting 15 minutes each, and a 30-minute debriefing, so 15 minutes again for each group, a 10-minute group discussion, and finally a 5-minute completion of evaluations. And then to evaluate their knowledge, the learners would then return demonstrate the administration of azacitidine on a mannequin during simulation. For objective 2, correctly answer 3 questions from a simulated patient related to the side effects of Vidasa. The learners will receive drug information about azacitidine's mechanism of action and its potential side effects. Drug information on azacitidine will be delivered in a PowerPoint presentation. And to evaluate, they will be asked these questions during simulation. When will I know if chemotherapy is working? Is this redness at my Vidasa injection site normal? And will the azacitidine cure my disease? These questions will be asked by the simulated patient. For objective 3, which is to identify 3 medical emergency situations during the simulation, the learners will receive information regarding the most common and deadly medical emergencies occurring in myelodysplastic syndrome and how they could quickly identify it and appropriately intervene. Information on medical emergencies for myelodysplastic syndrome will be presented via PowerPoint presentation. And the learners will be evaluated by properly identifying and managing 3 medical emergencies: sepsis, intracranial hemorrhage, and a transfusion reaction during simulation. So evaluation of student learning, we went through this. Learners will be evaluated during simulation, whether it's the administration of the azacitidine, correctly identifying the medical emergencies, as well as properly answering the questions of the simulated patient regarding the side effects of Vidasa. And most importantly, there will be a debriefing following the simulation at the bedside of the simulated patient, as well as evaluations following. I will be anticipating that will be group participation and meaningful peer feedback and self-reflection. For the presentation evaluation, the infusion nurses will be asked to answer these or fill out this form in which they're going to be stating whether they strongly disagree, or they're neutral, or agree or strongly agree to the below statements. 2 of the questions or statements on the evaluation are the same in which they were asked in the pretest or the Likert scale survey that they completed prior to the simulation. So I'm going to be assessing how they feel their knowledge has improved, as well as how they felt about the presentation overall, and whether they felt as though their questions were being answered appropriately. And I will allow them a comment section in which they're able to give constructive feedback. Additional resources include patient education, a nurse's guide to Vidasa, as well as a patient's guide to Vidasa, and some modules that the infusion nurses are able to complete and get some continuing education credits for. And here are some of my references. Thank you.